My name is Nicola Hutchison, and I studied the sports science degree in 2000. So I graduated in 2003. I chose this course because I was an international swimmer at the time, and I wasn't interested in really pursuing any academic career per se. So I finished my A-levels and wanted to swim full time, but there's no money in swimming. And it was actually my swimming coach that advised me to do something that I enjoyed, so that gave me options once my swimming career ended. So I chose a course closest to my base, which was Cambridge, that happened to offer sport courses, which was what I enjoyed. But mainly it made me believe in myself outside of the swimming pool. I grew up and went to secondary school at a convent where if you didn't get 10 A stars at GCSE level, you were considered a bit of a no-hoper. So the degree inspired me to apply my swimming attitude to my academic career, that I could be good enough and do anything that I wanted to if I put my mind to it. So I remember being given our first assignment by Dan and having no clue to what I had to do, how to reference, or a feeling that really I was going to flake it. But then when the marks came in a few weeks later, I remember Dan saying about how somebody got 85% and that this was unheard of. And I remember again thinking that I'd be the one that didn't pass or the embarrassment on the course. But it turned out that I was that geek, that the hours of research that I did for all the journal papers and the books gave me all the information to put my assignments together. So that was really the start of my interest in research. I never thought I'd do a master's. I didn't think I was clever enough, but I did in research and in sport physiology. And I never thought I'd even consider a PhD, which I also did. It made me believe in myself outside of the swimming pool. I was a swimmer where my only confidence really was in swimming. So I grew confident in myself. I would never have volunteered to be that person that did all the stress tests each week or the MVO2, certainly in front of other people. I mean, swimmers are rubbish at anything outside of a swimming pool, but it would be me volunteering each week, keen to get in, and in the end use it as a form of training to learn about myself. In terms of extracurricular experiences, I probably didn't. I was a swimmer. I was focused on the European Championships in 2003 and the 2004 Olympics. So my best pal at uni was Bob Chalice, and he just got it. He understood that I didn't socialize on nights out in nightclubs. I didn't really join any extracurricular clubs because my focus was being in bed by 9 p.m. to get 4 hours of swimming and 2 hours of land training in the following day. The time on the course prepared me for my career in terms of probably time management. I was so focused on swimming that I still had no idea what I wanted to do after uni other than swim. I guess I hoped to work in research with elite swimmers, so I took on a master's. I think I was the only one from my year group to do a master's. I did that at Essex University, a master's in research and in sports physiology. And in the end, it was a guy from my degree course who started working as a respiratory physiologist that convinced me that I could and would enjoy working in a hospital. But at the time, I never thought I would. I couldn't think of anything worse than working with old grannies doing treadmill tests when I'd been a swimmer and an elite swimmer. But that's where I ended up. So I applied for neuro, respiratory and cardio positions in the NHS, and I ended up in cardiology. Although I had to do another degree, it was so closely linked to the work that I'd done during the sports science degree that I did fall in love with it eventually. The staff back then in 2000 to 2003 was just Dan Gordon and Adrian Scruton. So they understood an athlete's life mingled in with university. But at the same time, they also reinforced that they'd take no excuses. So the course was as important as everything else that you did. So I'd say real world, understanding, but tough. My current job title is a technical specialist. I work for Johnson & Johnson, who are a massive company with various sub-franchises, one of which is cardiology. I moved from England to Northern Ireland the day of lockdown last year. So I moved from hospital work into what we call industry. My job entailed as a cardiac physiologist working in a hospital setting. We performed all the diagnostic tests on patients that would come into a hospital with palpitations, so with irregular heart rhythms, or with chest pain. So if a patient was having a heart attack, for example, we would be there on call within 30 minutes performing a procedure with the cardiac consultant to get those coronary arteries blocked up. To be honest, in cardiology, you choose electrics or plumbing, and I chose electrics. So electrics is like your ECGs, the way the electrical conduction of the heart works. And I now specialize in electrophysiology. So what I do now in my current role is create 3D and anatomical reconstructions of a heart chamber for the consultant, and I can tell them within 1 millimeter where that abnormal heart rhythm is coming from, and they zap it with RF, radio frequency energy. Practically, probably not much, because my role now is purely cardiac anatomy and cardiac physiology with a whole 3-year degree just on the heart. But it did instill the importance of research. So in my current role, we are assessed constantly, as in daily exams, on the technology, the latest research, and competition equivalents, so other companies that have similar products. So it's paramount that we have the ability to discuss the latest research and the implications of technology with our cardiologists, who are often the first to quiz you and ask you if you've seen the latest research papers. Advice I would give to somebody in ARU at the moment who wants to get into this role is to believe in yourself. To be a cardiac physiologist now, the training has changed. So 13 years ago, you were employed as a physiologist and they paid and sent you on a degree course, fully funded, happy days. But to get into industry now is so easy. All you would have to do is go onto the Johnson & Johnson website or look up Biosense Webster, which is the cardiology franchise. And to be honest, their training is fantastic, phenomenal. I wish I'd had the training as a physiologist that I had with Johnson & Johnson. We have many technical specialists in our company that don't have a sports science background and have no knowledge of cardiology. They just did biomedical engineering at university. And Johnson & Johnson is such a massive company that they don't exclude anybody. So just simply having a sports science degree wouldn't exclude you. You'd probably be right up there because of your general understanding of physiology. And they teach you everything you need to know. It's fantastic. I'm sorry I didn't go into industry earlier. So obviously I work in cardiology and ECGs are everything. From an ECG, I could tell you which cardiac vessel is blocked or not getting enough oxygen. I could tell you whether an extra beat that you're getting on your ECG is coming from the front, the back, the side, the bottom, or the top of a heart chamber. I could tell you if your heart chamber is too big. I could tell you if a heart is scarred. So as a physiologist, you think that ECGs are for juniors. What is the relevance of this? But it gives you a 10-second snapshot of the overall health of your heart. So if cardiology is something that interests you, it is everything. From the more general aspects, goal setting, sports science students, in my experience, are particularly competitive. They're astute and you've got goals. Without goals, you have little direction and little focus. And that applies, I think, to everything. So your life and your career. So with the company that I work for now, Johnson & Johnson, it is completely all about you. It's the first job that I've ever had where an appraisal is about you. In the NHS, you're so overworked and understaffed that it tends to be everything that you can do for the hospital, whereas J&J prepare you constantly for what you want to do next. It's all about your career, your direction, and what they can do to help you. So goals are everything. And then finally, your presentations. I remember as a student, I hated them. I thought they were pointless. And I convinced myself that I would never take on a job that ever involved having to do a presentation. But then I think if you hate something as passionately as that, then you're just so underconfident in yourself that you have to force yourself to do them. And I think what with COVID and Zoom meetings and Microsoft Teams, presentations are going to be the way forward. So get used to them. And remember that if you do enough research, if you make yourself as knowledgeable as you can be on that topic that you're presenting, then you should have the confidence to push on, that you will know more than anybody else that you're talking to. So do it.